Welcome to Maintaining Your Brain Health. My name is Amy Abrams, and I'm the Director of Education for Alzheimer's San Diego. We are a local nonprofit organization whose mission is helping families today and finding a cure for tomorrow. Here is our agenda for today's program. I'll start by reviewing some key factors in healthy aging, and then I'll describe the common symptoms of dementia and how they're different from normal age-related changes. And then we'll review the lifestyle factors that decrease the risk of experiencing memory loss and other types of cognitive changes as we age. So we'll start with a review of the key factors in healthy aging. There are some normal age-related changes that we can and should expect as we age. Our muscular and skeletal systems, for example, will change. We lose muscle mass, we lose bone density, our flexibility and our overall muscular strength decreases over time. Our cardiovascular system changes as we age, with the heart muscle and the vascular system becoming a bit less efficient over time. Changes to our digestive system are common, as are changes to our sensory systems. In particular, vision changes and hearing changes are very common as we age. And finally, our skin is our largest organ. It's our most visible organ, and we certainly can expect to see changes to skin and hair as we age. So it's important as we think about the aging brain to put it into the context of normal changes in the aging body. We do expect to see some changes to the brain as we age. It's typical that the brain loses some volume. We do lose a number of brain cells, and there is less communication between neurons, which are the nerve endings at the end of our brain, nerve endings of our brain cells. It's normal for there to be some reduced blood flowing to the brain because of those cardiovascular changes that I described before. So those physical changes will naturally lead to some normal age-related cognitive changes. We can expect to see some mild memory decline as we age. It does become more difficult to control and maintain our attention or our focus as we age, and we simply process information more slowly. The normal, healthy, aging brain will always be able to learn new information, acquire new skills, but it will naturally do so more slowly. There are many factors that will affect how healthy we will remain as we age. Of course, our genetics, the DNA that we inherited from our biological parents, disease risk factors, some of which we may have inherited from our parents and some of which we may have acquired through lifestyle. Our environment will certainly shape the way that we age. Our culture and our attitudes toward aging are shown to dramatically impact our health as we age. And of course, things like the type of work that we did and how much education we received will affect our overall health as we age. We're going to focus primarily here on lifestyle and those factors that we can control when it comes to our health as we age. So here are the basics of the lifestyle and controllable factors that are required for overall general health. Everything that you see on this list here is probably quite familiar. Managing what are called our numbers, keeping blood sugar, blood pressure, blood cholesterol levels, and our weight or our body mass index within healthy, normal ranges. Smoking cessation, managing our mental health, and addressing sensory loss. If we have vision or hearing impairment, getting that corrected. These are all important factors for our overall health, And here you see some key factors for brain health specifically. The bottom line is that taking very good care of your heart is the most effective way to take care of your brain. But here are the factors that we're going to explore in some detail here today: exercise and physical activity, diet and nutrition, intellectual or cognitive stimulation, social activity and connection, and sleep. So let's talk first about the common symptoms of dementia and how they're different from normal age-related changes. Dementia is the word that we use to describe a cluster of symptoms that are caused by some underlying medical condition, which impairs cognitive function and interferes with a person's ability to do their normal daily activities. So dementia is not any one specific thing. It is not any one particular disease. Alzheimer's disease is the most common of those underlying medical conditions that cause the symptoms that we refer to as dementia. So Alzheimer's disease is a progressive degenerative disease of the brain. And you see here in this image a graphic depiction of the difference between what the tissue of a healthy brain would look like versus the tissue of a brain that has been affected by advanced Alzheimer's disease. Here we have an explanation of the difference between normal age-related changes and changes that may be symptoms of dementia. They fall into these four categories that you can see on the left side of your screen: memory, thinking, physical changes, and behavioral changes. So normal age-related memory changes might be things like having a hard time remembering someone's name or finding the right words, losing things more often around the house. A memory change that might be something to worry about that could potentially be a symptom of dementia or some other brain change is getting lost in a familiar place, and not just losing an object, but actually forgetting the function of that object. Difficulty with thinking. As I mentioned before, we do become slower at learning new things as we age. This is a normal age-related change. It does get harder to focus your attention and to concentrate on more than one thing at a time. If you're a driver, you may have noticed, as an example, that as you've aged, you now need to turn down the radio or ask people to quiet down their conversation while you're driving in a new location, as an example. Right? We need to focus our attention more carefully. This is a normal age-related change, not something we need to worry about. But when we see that we're beginning to experience difficulty with planning, sequencing things, when it becomes not only difficult, but nearly impossible to retain new information, to learn new things, this is a possible symptom of dementia, something that we should bring to the doctor's attention. Next, there certainly are physical age-related changes, as I described before. Vision changes, hearing loss, other types of sensory loss, perhaps your sense of smell becoming less sensitive. We lose strength, we lose flexibility as we age. But what are some physical changes that are not normal age-related changes to be expected? Something like changes in your visual spatial perception, being able to tell, for example, how far away someone or something is. This would not be a normal age-related change. The significant narrowing of the field of one's vision, for example. Difficulty with balance and falling. And then the final category for these changes is behavioral. And it's very important to recognize that behavior changes are not a normal part of aging. So when we see that we or someone that we know are beginning to experience mood, personality changes, difficulty with the initiation of new things, getting started on tasks, or generally just sort of withdrawing socially, these are changes that could possibly be the symptoms of dementia. So who is at risk for developing dementia? Unfortunately, everyone. You see here the primary risk factors that have been identified in the research as contributing to an individual's risk of developing dementia. Age is the primary risk factor for Alzheimer's disease and most forms of dementia. Being female increases your risk of developing dementia. Your genetics and your family history play a role, but are certainly not the primary determinant of one's risk of developing dementia. These other health conditions that you see here, hypertension, heart disease, and type 2 diabetes, having these health conditions, either having inherited risk factors for them or living with them, these health conditions do increase a person's risk of developing dementia. The number of years of formal education that a person has affects their risk. Lower levels of formal education do increase a person's risk of developing dementia. Having sustained a head trauma that resulted in a concussion, or individuals who have Down syndrome. It's a developmental disability wherein a person has 3 copies of the 21st chromosome. Head trauma and Down syndrome are 2 conditions that do produce a very high risk of developing certain types of dementia. So, there is no definitive evidence yet about what can prevent Alzheimer's or age-related cognitive decline, according to the National Institute on Aging. But there is good research about lifestyle factors that can reduce a person's risk of developing these conditions. So let's spend some time talking about those. We'll start by talking about physical activity. Research shows that regular exercise increases the volume of blood vessels as well as the quantity of blood vessels that are supplying blood to the brain, and that exercise strengthens the connections between neurons. Getting regular physical activity is shown to raise the level of nerve growth factor in the brain and to stimulate the brain's ability to not only maintain our old neural connections, but to help us create new ones. Diet has been studied extensively, and in particular, the Mediterranean diet is well researched and shown to lower the risk of several health conditions, including the risk of cognitive decline related to dementia. So what is the Mediterranean diet? The principles are listed for you here. It includes plenty of vegetables and fruits, lots of those dark leafy greens and brightly and darkly colored fruits, which are rich in antioxidants. Plenty of legumes and fish. So what you see here is that this diet is pretty heavy on plant-based food and pretty light on animal-based food. Most of your nutrients, your fat, your protein, is coming in the form of legumes and some fish. Whole grains and whole cereals, which provide lots of fiber, and then good fat. The example that we've included here is olive oil. When we say good fat, we mean fats that are monounsaturated, primarily fats, oils that are coming to us from nuts and seeds and things like avocados and olives. Moderate amounts of alcohol, for those for whom alcohol is not contraindicated for other reasons, are demonstrated to have a positive impact on brain health. What you'll notice is that nothing is strictly prohibited within these dietary guidelines, but it is recommended to try to lower one's amount of saturated fat, dairy, meat, and poultry. And of course, your brain, as many other systems within your body, needs to remain well hydrated. So staying cognitively active is critically important for our brain health. There is a theory called the theory of cognitive reserve, which posits that for individuals who have spent many years of their life engaging in the types of activities that you see here on this screen, that these individuals are not necessarily at any less risk of developing the pathologies of Alzheimer's disease or other forms of dementia, but that these activities may establish what's called a cognitive reserve that enhances the brain's ability to continue to function as normal or to compensate for damage from these diseases as they progress. So examples of cognitively stimulating activities or intellectually engaging activities are reading, learning a new language, or acquiring a new skill. That could be learning to knit or to crochet, for example, taking classes, attending lectures, joining in on discussion groups, certainly playing games and puzzles, especially those that require the use of strategy, and listening to music, or even better, playing music if you are so inclined. These are wonderfully brain healthy activities. The most important point about cognitive activity is that first one, that the experiences are new and that you are presenting yourself with new challenges, activities that require you to solve problems in new ways. So it really could be something as simple as taking a new route home, for example, changing up your regular walking route, meeting new people. Right? Anything that is what we call novel. This helps your brain to create new connections between those neurons, new neural pathways, and to enhance one's cognitive reserve. All of those activities that I described previously that are cognitively engaging and stimulating, they are made more effective when we do them with other people. Humans are primates, we are social, and we are absolutely wired for social connectivity. For good health overall, and especially for good brain health, we need to interact regularly with other people. So researchers have found that there is a relationship between frequent social activity and better cognitive function. There's also interesting evidence that people who engage regularly in social activities, who see other people regularly, that they may have other lifestyle factors that help protect them against Alzheimer's disease and other forms of dementia. So that means that as we age, our peers, our friends, our family connections, our social connections tend to have a positive influence on us. We eat better, we get more exercise, we tend to engage in more of those cognitively stimulating activities, for example. Finally, the very important topic of sleep. There is growing evidence that individuals who have a chronic lack of deep sleep may be at an increased risk of developing Alzheimer's disease. And the evidence is certainly clear that sleep is critical to a good functioning memory and overall brain health. Our sleep needs do not change dramatically as we age. 7 to 9 hours of good sleep is generally still required for most adults at any age. The reality is, most older adults are not going to be able to sleep 7 to 9 hours straight through. The goal is to sleep those 7 to 9 hours, get through some complete deep sleep cycles several times per night. So a few tips are provided here on what is called sleep hygiene, sort of establishing good rituals and habits related to sleep. So as best you can, establishing a routine, sticking to regular sleep times and regular wake times. Training your brain for sleep, meaning you teach your brain that the bed is for sleeping, not for sitting and working or talking on the phone or watching television, for example. Making your room comfortable, which for most people means a cooler temperature and little to no light if possible. Limiting naps during the day, limiting caffeine in the afternoon and evening hours, and limiting alcohol after dinner time. All of these things for most people will help to stabilize the sleep cycle and help you get more of that all-important deep sleep. And finally, if you're exercising regularly, the research does show that this helps to improve the quality of your sleep. All of these things together improve your ability to get enough sleep and to get good quality sleep, which is shown to improve your brain health. So what should you do if you are concerned? If you're noticing some of those signs and symptoms that we talked about earlier, do talk with your healthcare provider. Share your concerns with other people. If you're concerned about the memory or behavior or personality changes of a friend or a loved one, I really encourage you to have an open and honest conversation about the changes that you are seeing. We encourage you to seek out memory screening, which is available through your primary healthcare provider or through several community agencies, including Alzheimer's San Diego. And ultimately, a memory screening may lead you and your physician to seek a diagnosis. But keep in mind, the signs and symptoms of dementia can certainly be caused by many different types of medical conditions that might be contributing to memory or cognitive changes that you're noticing in yourself or someone that you know. Some of the most common examples of those types of medical conditions are a medication, an interaction, or a change in dosage. Certainly depression and other forms of mood disorders will impact a person's memory and the clarity of their thinking. And when we are sick or coming down with an infection, a urinary tract infection even, very minor illnesses and infections can and often do impact memory and our cognition. So don't be afraid to talk with your healthcare provider about changes that you're noticing, to be screened and see if one of these underlying medical conditions may be detected. So at Alzheimer's San Diego, we are a local nonprofit organization providing a wide array of free in-person supportive services for individuals who are worried about memory changes, who are living with a diagnosis of Alzheimer's disease or another form of dementia, or who care for someone who is. You can find a variety of information about Alzheimer's disease, other types of dementia, and more detailed information about brain health on our website. You can reach out and connect to our social work team by phone, by email, or by live chat, which is available on our website. Or our office is in the Kearney Mesa area, and we are open Monday through Friday, 8:30 to 5. For more disease information and for quality, authoritative information on brain health, I've provided for you here a list of several organizations that provide good, credible, evidence-based information: the Alzheimer's Association, the Alzheimer's and Related Dementias Education and Referral Center, called ADEAR, of course, our website at Alzheimer's San Diego, the CDC, the Family Care Alliance, which provides wonderful resources for caregivers, the Mayo Clinic, the National Institutes on Aging, and UCLA has a wonderful Alzheimer's and dementia care program. So please reach out to these organizations or contact us anytime at Alzheimer's San Diego for more information about how to keep your brain healthy as you age. And I thank you very much for your time.